Good afternoon. Thank you so much. I know it's late. I appreciate you being here. Thank you, Tanya, for the introduction and the opportunity to present at the Congress. My name is Julie Wei. I am a mother. I'm an ENT surgeon, and I call myself an activist. How many people here have children? Excellent. Okay, and even those who don't, I know their children, they're your patients and your families. So I live in Orlando, Florida for the last 6 months, and we have a university there. Before that, I was in Kansas City. Yes, I have a very small business. It makes no money. I've published 2 books. You'll find me on Amazon. And the views I present today are mine. They do not represent my hospital, Nemours. And I gave you the card so you can find all of my 17 years of passion and work and what I've learned that they didn't teach in medical school and residency and fellowship, but what I've learned so I can be a better doctor for my patients. And this is my inspiration and my purpose in life. I thought I was a pretty good doctor. I trained for a long time, but it was after I became a mother that I knew I needed to be better. Because when doctors and surgeons recommend treatments to other people, many times when I go to meetings and I listen to panels and I look at these pictures of surgeries, I always wonder, would you do that to your own child? And that's how I know that for me to be my best, I need to think about ways to help children and families when it doesn't involve medicine and surgery. So that's my inspiration. You see my daughter Claire, she's 13. I have a wonderful husband and my patients and my colleagues. And so this is my movement, one woman, okay, trying to start a movement. My goal is to help as many people with children to figure out what I have learned to decrease medication use. Many times because it's a misdiagnosis, and a lot of it is ENT problems. I want to share with you what I've learned about how diet and lifestyle can cure thousands and millions of children around the world who are showing up to ENT clinic and their pediatrician offices, and it's all preventable. For me, coming from the United States, healthcare is a complicated medical system. We have so many millions of children who are born healthy. I don't understand how you can come out healthy. No heart problem, no big problems like you're hearing at the Congress. But by 2 and 3, you're on 4 medicine, 5 medicine. Everybody thinks you're sick. You look sick, but you're really not sick. And it has a lot to do with acid reflux, right? So the diet habits today around the world, it's not just America, because a lot of the things in the Western and American diet has spread around the world. I'm from Taipei, Taiwan, and I think that also for the first 10 years of my life, being raised in my culture has helped me with this perspective about what is missing in America. So most children with reflux, gastroesophageal, laryngeal, pharyngeal, they don't have heartburn. They almost always have ENT upper airway symptoms, and it's reversible. So I want to tell you a story because I have thousands of stories when I started paying attention. This is a 3-year-old boy. He's medically healthy. They come to me. I am the 7th specialist they go to see. They've seen pulmonology, GI, right? You're hearing the aerodigestive program. And the problem is he keeps having croup. They are afraid to go to sleep at night because the mother says, at night, oftentimes he has an episode. And I want you to know this is what they hear at night. They're trying to keep him calm. Does that make you nervous watching that? It makes me nervous, okay? So they run to the emergency room. And every time they give him nebulizer, right? They've 2 times called ambulance because it's scary. He's biphasic stridor, retraction, they get there, and you know what? Usually after a breathing treatment, he's okay. He doesn't stay at the hospital, they send him home, right? And so they tell him, you have croup, so here's your steroid. Everybody has a bottle in the refrigerator. Then, this is one example. I started asking, something's not right. I'm a surgeon, I cannot operate. I can do an endoscopy, but I never find anything. So I started asking all my patients, what are you eating and drinking? This boy, he drinks chocolate milk all day. Breakfast, snack, lunch, afternoon, dinner, and every night before bed. What the video I just showed you is reflux-induced laryngeal spasm. Laryngeal spasm is there to protect us so we don't aspirate. So when you're breathing against a closed glottis, that's how you get biphasic stridor. Okay, and it's like a cramp. The ladies that wear high heels, you know what I mean. Sometimes you get a cramp. You just wait, the cramp will relax, and that's what happens to these children. And when I ask them, they're not sick the day before. So Dr. Chevalier Jackson is an inspiration to me, right? He is the father of bronchoesophagology. But you know what inspires me is in 1927, many people don't know, yes, he developed the tools for airway foreign body, but he cares so much about public health. He helped to create the Federal Caustic Poison Act, which made the government require that there are labels made to warn people of injury and death from lye ingestion, because it caused significant injury. And then in the United States, you have to label all these other chemicals that can hurt people. So I ask myself all the time, what are the ingestion risks for the 21st century? Now it's not so much lye, we don't use that, right? Children still die from eating the laundry detergent pods. But the biggest risk that happens every day is the diet. So this is a 10-year-old boy. I'm an ENT surgeon, so they come see me, healthy, born healthy, no problems, but they come see me because he has hoarseness. So I'm gonna play a video. Sorry, I don't have video stroboscopy at this office, it's just his voice. Oh, this is sensitive, let me try. What's your name? Can you count to 10 for me?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. Okay, so you hear, right, raspy? We have an expert here who can tell me he's not stuttering, but he does have a raspy voice. I noticed something about him. I'm not a dermatologist, but look at his skin. He has such bad eczema. So I know he has allergies and he's itching, and the mom says, look, we already went to the dermatologist, we saw the allergist, all the allergy tests is negative. But he itched so hard, he bleeds, he cannot sleep, he wakes up because it's miserable. I said, okay. So I asked something no other doctors ask. Tell me what you're eating and drinking the whole day, So he drinks soda 2-3 times a day, juice, Hugo, and then some. Lots of sports drinks. In America, it's Gatorade, and so many other brands, sports drinks, huh? Never drink water. He's not one. Most American children, they don't drink water anymore, right? So he has, I did a flexible scope. He has significant inflammation. It's red. You call it erythema, maybe. So I said to them, and by the way, as a surgeon talking to a family about what are you eating and drinking, sometimes the parents think I'm a little bit crazy. They say, what are you talking about? I came to a specialist. Do you have a medicine, or what are we gonna do? I said, no, this is what I need you to do. We need to change his eating. And I talked to the mom, so you can see his diet is terrible. But I take notes of what he eats, and I told the mother, every day, this boy is drinking over 280 grams of sugar. Every 4 grams is 1 teaspoon. So this boy is eating 70 teaspoons of sugar every day or more. That's just the liquid, you know what I mean? So when I explained to her, she says, you know, I went back to school. I am working all the time. I used to cook dinner, but now I'm so busy, we eat out. We go to fast food restaurant, I don't cook as much. I haven't been paying attention to his diet. So I said to her, I want you to believe me. I swear on my mother's grave. My mother died when I'm 9. I said, you try it. If it doesn't work, I'm crazy, that's okay. But if it works, your child will be better. So 4 weeks later, no medicine, nothing. Look at his eczema. Just by cutting out the sugar, the eczema healed because there's so little inflammation. And then in 8 weeks, all the eczema healed. Mother said, oh my God, he sleeps all night. All night, thank you. And here's the video. I'm sorry it's backwards, but you can hear his voice. Remember, he came to see me for hoarseness. Oh, I'm so sorry. Let me see if I can.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay, he keeps counting. We don't have to keep going. Huh? Okay, so I don't have video stroposcopy, but can you hear? He's better. He's not as raspy. So it's because his reflux is better. I don't know about your country. This is my country. This is my grocery store. I go in there. Yeah, I came to United States in 1980. They didn't have any of this in 1980. Now this is all it is in America. Is it like that in Brazil? Is it like that all around the world, right? Okay. So the other thing, the reason this is important to me until the day I die, I will keep talking about it. It is not okay to make kids sick. And now the victims are younger and younger. They're infants that are born full term. Right? You believe in God or whoever made our baby 5,000 years on earth. They were fine. They come out healthy. And then this is what happens in America. Yogurt has become the huge industry because we tell people yogurt is good for you. We give too much antibiotics. You need a probiotic. The new thing is a prebiotic. You got a prebiotic, a postbiotic. you just need to take all this stuff. So people believe marketing. So when you put a beautiful baby that says, you can be healthy, look at that, and the parents buy it. This is one of the #1 problems for children with ENT symptoms is this. And it is because things that we doctors are never learned in school. We're not teaching this. Do you know that fructose has been changed? It used to be 55%. Now it's 90%. There's something called neo sugar. There's another ingredient in yogurt that you find in silly putty. Silly putty in America is like a gelatin, like you squeeze and play. This is stuff that your body cannot digest. There's even studies that are showing nanoparticles your eyes cannot see, but they're linked to inflammation of the GI system because this is not natural. This is not natural. I'm not talking about in Greece. If your grandmother made yogurt, or in India, or in Taiwan when we used to make our own soy milk from soybean. This is stuff made in a factory, right? So I want to talk about this. I became a rhinologist, okay? Because every day the parents, they come, thousands, right? They say, oh, my 2-year-old, my 3-year-old, the nose is running all the time. So the pediatricians say we have allergies. So we're on all the medicines in America for allergies, even though they're not tested, right? Oh, the other thing, when I trained, I never met this diagnosis. My child is always sick. How many of you hear that from your parents, your patients, say, my kid is sick all the time, I don't understand. So they tell me, right, I've had so many antibiotics because the pediatrician says he has sinus infection. Oh, he has asthma, allergies, and always sick. But then, many times I said, oh, do you have fever? No. Do you go to school? Yeah. And when I look for the last 10 to 14 years, this is what I notice every day in America in the chart. The children are born healthy, but now by 2, 3, 4, they're on all these medicine every day. Easy for a doctor to prescribe. They get refills for 1 or 2 years. Nobody's asking, what's the side effect? Every medication has side effects. But the funny thing is they're not better. If you're on the medicine and you're better, I would not be here talking. You see, they're on the medicine, they're not better. That's why I'm here today. So when I ask, this is what most children now have, very high dairy and sugar. And then the parents say, oh, he's so picky. How many people here know picky children? They only eat 3-4 things, right? So, and they're not eating fresh fruit and vegetable. And oh, I'm an ENT that asks about constipation. That's kind of crazy, huh? Because if you have constipation, your gut is not moving. You're going to have more reflux. Everything stays. And nobody's exercising as much. Children are not playing outside, many reasons, right? They're on their tablets. Is it like that in other countries? I meet 12 months old. They are in the office. They don't speak, but they can swipe with their thumb. It's very interesting how quick they learn to do that. So I said to myself, why is medicine not working? I think I'm smart, I'm a doctor, I'm educated. If a medicine is prescribed and you have the diagnosis, right? If you have asthma, then albuterol and inhaler should work. But medicine's not gonna work if you don't have the disease the doctors say you have. Medicine's not gonna work if you don't give enough dose. And then now we have precision medicine. It depends on the person. Sometimes not all medicine work the same. Or sometimes it's just a bad medication, I don't know. But I've been thinking for many years, what's missing in my training? I'm very lucky. I'm an immigrant. My parents work hard. I go to university. I did my ENT training at the Mayo Clinic. Many people say, oh, the Mayo Clinic, right? I got wonderful training. I did my fellowship. Well, every day I'm doing this in the office. What's the reason you came? What's your history? I'm looking at the kid. Well, what am I never doing? We never learn how to ask the patients, what are you eating and drinking? And I said, well, wait a second, if we're seeing adults, if you're an ENT, an adult, every patient you say, do you smoke? Do you drink alcohol? Because those are factors that cause cancer. And yet for children, we never ask about that. But this is what I ask. That's what makes me different. That's helpful. I ask, hey, how much milk does your child drink? What kind? Strawberry, chocolate, white, 2% whole? How much juice? Do you drink Capri Sun, the pouch? How much yogurt? What kind of yogurt? What time is dinner? What time's bedtime? What do they eat after dinner? And do they drink milk at bedtime or have cereal and milk? And this is where I learned how to magically fix children's problems. Okay, American teenagers are horrible. I've been asking for 10 to 12 years. 9 out of 10, they don't eat breakfast. The parents will tell me, but nobody does anything. They don't eat lunch. They say, oh, it's disgusting. The ones that eat lunch are having soda and pizza because they buy it from the machine. I don't know how it is in other countries. And then they're tired because they have bad eating habit. They're hypoglycemic. By the time they come home from school, they're so hungry. So they binge. And then they're up late, Facebook, right? Friends, and then they're hungry, so they eat. So many are already at Starbucks, right? In junior high, high school, because Americans think energy comes from Starbucks, all around there. So they're drinking frappuccinos, right? The 1,500, I don't know how many calories. They're not doing a whole lot, not getting sunlight. And also, I've learned children eat the way their family and parents eat. So when the parents don't eat fruits and vegetables, and the parents, and in America, we go to fast foods, and how can the children be better? So the parents, this is amazing, after almost 15 years, the parents all believe milk is good for you, the more the better. If a kid is not a good eater, let them eat have as much milk. It's nutrition. And yogurt is good, so anytime they want, they can have it. And this is marketing. This is marketing in America. Look at the famous people. Do you guys all know Taylor Swift? The professional football player. This is what breaks my heart. The little girl, her cup of chocolate milk is half her size. She's the one that's going to be in the video I showed you with the laryngeal spasm, no? But it's worse. Look, milk is sexy. Do you see these ads? Kind of interesting to me, right? So the parents will tell me every day, they go, no, it says 100% juice. So they think because it's 100% juice, it's the same as eating fruit. And nobody knows how to read the nutrition fact label. So every day in my clinic, I teach the family how to look at the sugar. And if you can do simple math, you divide by 4 so you know how many teaspoons you're getting. People believe if it says organic or 100%, then it's okay. But you know, I tell them that's not. The other thing that's interesting, I'm not here to blame, you know, I'm the same the same doctor that talked about burnout yesterday. But I will tell you, certainly in Florida, you know, in the American Academy of Pediatric have guidelines. They just changed it. No juice younger than 12 months, from 1 to 3, 4 ounces in a whole day. From 4 to 6, no more than 4 to 6 ounces in a day. Do you know in my patients how much juice they drink in a whole day? Sometimes 24, sometimes 36 ounces. Every time I ask a family, do you know the guideline? Did your pediatrician talk to you about it? Majority say, I never knew. Nobody told me. Nobody. So, okay, so then this is on my website. I gave you the card. You don't have to take everything I have. I try to make for free. I need to, after World Congress, I'm going to translate the website to Spanish to help more people. But basically, I try to explain to the family or to any mother or grandmother, you would never stand there and say, here, 1 more teaspoon of sugar. No, 1 more. You need to eat 1 more teaspoon of sugar. And yet every day when they eat it, we're not thinking about it. Sugar is very addicting. I find it very interesting. It's stronger addiction than cocaine. Did you know that? Do you know in newborn babies, if you do a tongue tie, you put sugar water and they stop crying? Because it makes you feel so good. It goes, I don't know about you, who here likes chocolate or sugar? I do. Yeah. So here's my concern. When early in life, in 1 or 2, we start to expose to sugar so early, you get addicted. So for over 10 years, the parents tell me, I tell them you need to drink more water. It's funny, you know, they say to me, no, doctor, you're crazy, it's impossible. So they send me videos. They send me videos of 2-year-olds crying and screaming and throwing the cup of water. They're so angry. I say, you act like that when you're an addict and you're going through withdrawal. So this is a challenge. So I think, you know, I think all the time, why me as a mother or another parent will give in? I think you know your kids should not have so much sugar, but we're guilty. We're all working. I don't see my child very much. There's no limit. Nothing seems to have limits anymore. Nobody's reading the label, and also you believe in the marketing. But I have to say, I'm 49 this month. This belief that I have to make my child happy. How many people here want to make their child happy? Am I the only one? Yeah. When my father was raising me and my mother, I don't think they asked that question. But we're nicer, right? So when people know, Tanya knows me from a few years, I call it milk and cookie disease because it represents dairy and sugar. And there are many things that are the problem. But milk and cookie disease was a term that I used to represent dairy and sugar. And there's a reason. I was on a TV show. You'll find this on my website. The reason I picked dairy and sugar, I don't have a nutritionist background, but here's what I learned. Dairy and sugar, meat, soda, these are the most acidic food in the world. Caffeine, alcohol, right? So sugar breaks down to alcohol carbonic acid gas. Alcohol becomes vinegar. It's acidic acid and water. Milk, when it comes out of the refrigerator cold, it's neutral. pH is 7. But when it's in your body at 98 degrees, as the temperature goes up, the acidity drops. All of a sudden, the pH is 2.2. So when a baby or a 2-year-old drink milk, they fall asleep. The milk is in the stomach. It ferments, and it looks like this cup right here, you know, it becomes very nasty. If you ever have a baby throw up or vomit, do you smell how sour it is? That's what it is. So I started thinking and looking into what research there is about gastric emptying time. So for all humans, generally it's 4 to 6 hours to finish emptying everything. but it's increased. It stays longer if you're diabetic, if you have a cold, if you, it's shorter if you exercise, you have a lot of fiber, you drink a lot of water. But what's interesting is there's so much science already published by people that are not doctors, right? Osmolality and carbohydrate, it takes longer. When the higher the density, it sits in the stomach longer. Then I think about, as a surgeon, we all know there's NPO guideline. You cannot do surgery if the patient eats less than 8 hours before. Why? Well, because there's still stuff there. So what I learned is, carbohydrate takes a long time to get out of the stomach compared to protein. In America, everybody loves mac and cheese and pasta. Okay, and so those things, have you ever had pasta Alfredo, then afterward it tastes so good, but you feel heavy? Like, oh, I feel like a brick in my stomach. Oh, it takes a long time. The higher the fat, the longer the emptying, the higher the osmolality. So, yeah, this is biology, high school probably, right? When you have juice, when you put a lot of sugar in the liquid, the osmolality is high. And you get bloated, so the more distended, the worse. And I have references for this, and I made a video. You can Google me. It's called The Kitchen is Closed. So now I want to take a moment and ask you a question. The day that I asked myself this question, it really opened my eyes. I am a pediatric ENT. I spent early part of my years prescribing, Zantac and Nexium along with my pediatric GI colleagues. But here's my question. How well do you think Nexium and Prilosec work against the acid we're eating and drinking? Do you really think the pill will work for that? I'll tell you the answer is no. It may stop your stomach from producing acid, but when it's a Niagara Fall, it's a waterfall of acid, the child will still have the symptoms. So children also have more reflux. I said, well, wait a second, what's going on? And I look at my baby from the time she was little. The distance from the stomach to the mouth is not very far. Maybe I'm too simplistic. Right? You spend all your time in the car seat, you don't walk, you lay down, so you get a lot of stuff. You always you eat first, then you go to sleep. So the mothers are used to when they're babies. We don't want a baby waking up hungry, so we feed them, right? But then the baby's 2, the baby's 3 and 4, not a baby anymore, but we're always worried. The mothers always worry the baby will be hungry, so we always want to feed. So, but too much acidity. Oh, and the other thing, I have so many children because they're skinny. Everybody said, you can eat whatever you want, you're skinny. But turns out they look skinny on the outside, they're very sick on the inside. Huh? So I won't go into this, but I will tell you, for every medication, we find all this research now that we didn't know. In 2010, FDA says you should never really not have more than 3 to 14 days a year of proton pump inhibitor. There's all the side effects. In other countries, do they have the commercial? Like in America, I see a commercial of a beautiful sunset, a man and a woman holding hands, some sunlight, and there's some drug. And then you're watching this beautiful commercial, and then some man says, side effects including drowsiness, blindness, death, seizures, Why don't we worry about our children and what happens when they take these medicines? And now we know when you take PPI for a long time, bone fracture, you're not absorbing iron, calcium, magnesium, B12. B12, if you don't absorb it, you get neuropathy, and there's some other issues. So I'm not a nutritionist, I learned a few things, I just tried it, but I've been trying it for 15 years, and I kind of know what helps. I say, look, every family's busy, but eat dinner as early as you can. I think some of the other cultures are better. They eat a big lunch, maybe a lighter dinner. Americans love our sugar. My house too, my daughter, my husband. So I said, if you're going to have dessert, my husband says, you're always ruining childhoods. You make everybody unhappy. You take away their sugar. I say, eat your cookie right after dinner, but don't wait. Don't wait till before bedtime. No bedtime snack. That's a big one for me. You want to try to go to bed without, any time we can give. The younger the baby, first year, I don't mess with you. You eat as much breast milk, formula, whatever you want. After 12 months, no more milk. You know, that's a hard one. If it's my baby, they want the bottle, so I'm very clear that if you don't have problems, you do whatever you want. But if you're coming to my office because of chronic cough, congestion, runny nose, all these things, then you try this for 3 days. So fast, so fast. Now I want to tell you, I'm a scientist too. So I know that nobody's going to believe me if there's no data. And someday I hope I can speak to millions of people, because usually people are not interested in this. I used the Sino nasal quality of life survey. I actually had 28 patients. I had them fill out the survey to look at their symptoms. And I did the baseline, so when you look at the number, you look at quality of life. The higher the number, the better. After I changed some diet stuff, after 4 weeks, they repeat the survey. And they report themselves, less symptoms, less obstruction, breathing better, life is better, quality of life is better. But I want to tell you that so much of my research I cannot get published. They get rejected by the journals. I'm published in many areas, but this kind of stuff doesn't get published. So what you're going to see is not published because I keep getting rejected. Okay? But I want to tell you about chronic cough. I looked at 54 patients, average age is 6. 21 of them have coughed for 3 to 12 months every day and night. 13 have coughed more than a year. And remember, they've already seen the pulmonologist, the allergist, and everybody. We have follow-up for 30, not everyone, 30 of 54. 19 of them said, we did what you said. We stopped eating at bedtime, we cut the dairy and the juice. And of the ones that follow, almost 70% said completely resolved. Completely resolved. So together, you want to talk about overutilization of healthcare. 54 patients together, 189 visits to the specialist. There's not enough doctors for the number of people in the world. These children do not need to be in a healthcare system if we focused on this. So sugar increases inflammation. I won't repeat all this. I will tell you, this has been proven. Bronchitis, asthma, inflammatory markers, yeah? So I did a pilot study. I said, okay, how am I going to change the world? Very hard, right? I've been doing it one patient at a time, but I have millions of children I want to help. So I did a study where I measure interleukin, anti-inflammatory marker, pro-inflammatory marker, including alpha-TNF. We usually look at alpha-TNF for inflammation and for cancer. I also looked at cholesterol and triglyceride. I checked everything. I did the quality of life for the nose, and then I recorded every day for 14 days how much sugar. And so in this small study, what happened was I planned for more people, but between age 2 and 6 is who I focused on. But so many parents, after the first time, they didn't come back because they don't want the child to get a blood draw. So they didn't complete the study. But when you look, basically, I want to show you that before my diet counseling, the group that have the nasal symptoms, ENT symptoms, up to 83 grams of sugar. But after counseling, they were able to, the parents actually, they believed and they tried it. But what's really important, this study is published actually, it took a long time, not in an ENT journal. It's in Journal of Medicinal Food. I didn't give up. But here's what I found, and I don't have enough patients, so now I have a R21 grant that I've submitted. Wish me luck, pray for me, okay? What I found was, wow, they have really significant difference in the inflammatory markers. So the children who drank so much sugar, the pro-inflammatory markers were high. The anti-inflammatory markers that our body naturally makes are low. We also found a trend towards increase in anti-inflammatory markers in 2 weeks. So if you just cut your sugar, your systemic inflammation goes down. Already your natural systemic markers show the improved health. So I live this fantasy that if maybe every doctor's visit, not just ENT, imagine for children if we always include the diet history. if schools and government stop allowing unhealthy foods and drinks, but I know that's not going to happen, not in my country, because money comes first. It's always about profit and margin, and that's unfortunate. But we doctors cannot do this alone. Hospitals, teachers, you know how many parents I ask, their child is in daycare. I said, what does your kid eat in daycare? They said, I don't know. Do they give juice there? I don't know. I said, I would ask you to please ask. But we don't teach about health anymore. Not in my country. The children don't understand. They're not learning about nutrition. We don't teach them how to read a food label. And I think that's really important as a part of our education. And we also, every government, of course, right, we need policies. If you don't have regulation and policy and regulate how much sugar that the public gets, then that's a problem. So I hope this has been interesting to you. If nothing else, I blog every Tuesday, Thursday. You can find me. I hope to have a cookbook come out this summer. I love food. I cook 5-6 nights a week. You know, I just want to help as many children be healthy. So thank you for your time and for coming today.